All right, so I'm excited to show you a really interesting case. This is a gentleman who has a very significant amount of upper body or chest breast tissue. And so we're gonna look at his pictures. I'm gonna show you our plan today to strategically help him alleviate this issue for him. In particular, he likes to play golf, so he notices kind of these almost man boob-like appearance in his golf shirts. So we're gonna look at these pictures here. So you can see there's a fair amount of tissue in the lower part of the chest, almost this breast-like shape. And this is two components. First of all, this is a really big dude. Second of all, he has an excess amount of adiposity or fat in this area of the chest and the sides of the chest wall. This creates almost a little bit wider torso in the upper body. In addition to that, underneath each one of the nipple areola complexes, there's a little bit of breast tissue. So through a tiny incision at the base of the areola where the color changes at that border, I'm going to perform vasor or ultrasound-assisted liposuction of the area of the side of the chest and this area here, going across this side, and from this side I'm going to do the same thing on the other side. This keeps it minimally invasive with very little appearance of the incision. In fact, this incision will heal so well, no one will be able to tell me you had this done. The second component is to then go through and make the incision a tiny bit longer, so about 1.5 centimeters, and do what's called a pull-through technique to remove the breast tissue that's underneath each one of these areas. This will ultimately flatten his chest. We'll put him in compression for the next 4 days, and then after that, we'll take off those garments and take a look and see how he looks in the clinic.